Welcome to this Ophthalmology for All video lecture series. In this lecture, we will understand about stye. Stye is also known as external hordeolum. It is a very important ophthalmic problem. Objective of this lecture are to understand clinical picture of stye, causative mechanism of stye and management of stye. Here you can see the cross section of eyelid where you are seeing skin, subcutaneous orbicularis oculi muscle, levator palpebrae muscle insertion, then tarsal plate containing meibomian gland. At the margin of eyelid there are eyelashes, and attached with eyelashes there are gland of Zeiss and mole. Stye is basically infection of the gland of Zeiss at the hair follicle. It can be defined as acute suppurative inflammation of lash follicle and its associated glands of Zeiss and mole. Regarding the causes or etiology of stye, there are certain predisposing factors like age. In younger age group, stye is common. Then habitual rubbing of eyes, or if we have got poor hygiene, then also we tend to develop infection of lid margin. Also, if there is chronic blepharitis, there is inflammation of margin of eyelid, then also stye can develop. People with diabetes mellitus are more prone to develop stye. People using more alcohol can also develop more stye. Usually the causative organism for infections is Staphylococcus aureus, but sometimes other organisms are also can cause this infection. Symptoms wise, patient will describe that there is acute pain in the lids and surrounding the eyes depending upon the amount of inflammation. There is swelling of eyelid, there is watering also, and to some extent there may be some photophobia or resentment to light also. Here you can see there is in the lower lid stye is there, while in the upper lid chalazion is there. There is some difference between chalazion and stye. Chalazion is swelling of meibomian glands which is situated somewhat away from lid margin, while stye is infection of gland of Zeiss which is situated right at the margin of eyelid. In signs, when you examine the patient, you can see the tender swelling, firm swelling, marked redness is there, and there may be stage of cellulitis. There may be marked edema. If this infection is allowed to progress further, it can be converted to abscess. Localized visible abscess can develop. Initially this pus pointing may be seen at the lid margin, but if it progresses, it may involve whole of the eyelid. Regarding treatment of stye, antibiotic eye drops and or antibiotic ointment is the mainstay of treatment. For example, moxifloxacin or tobramycin can be used as a broad spectrum antibiotic to treat stye. Orally we can give anti-inflammatory and analgesic agents like diclofenac, aceclofenac and paracetamol can be given to minimize edema and pain. If stye is very severe, infection is quite marked, we may think of giving orally antibiotic tablets also. Hot compresses over the eyelid, over the eye, can help to lessen the pain and inflammation component. If we can see the pus pointing at the lid margin, we can think of evacuation of the pus. We can do a small surgical incision to the pus pointing and evacuate the pus, thereby relieving the inflammation. Some people who have got recurrent episodes of Stye, we should investigate for the cause of diabetes, and if it is found, we should treat diabetes mellitus and other associated poor hygiene causes. Here you can see hot compresses can help to relieve the Stye. Thank you for patient listening to this lecture on Stye and in the channel of Ophthalmology for All. Thank you.